I'm here with Linda Rudolph now, who helped launch the Health in All Policies Task Force in California. Thank you for being here. Such a great idea, and I know public health has long partnered with other sectors. Can you discuss how this concept of health in all policies really differs from simply partnering with another sector?
I think that health in all policies really looks at institutionalizing the consideration of health, equity, and sustainability into decision making across all sectors. And we try to create formal legislated mechanisms that allow policymakers to be informed about the consequences of health on health of their decisions, and to create structures that really foster collaboration, not just with one agency at a time, but with multiple agencies talking together about how they can attain shared goals and be cognizant of each other's priorities and concerns as they make policies.
Can you give me an example of how it has been successful in California and how really to get other states involved so we're moving this whole initiative?
Well, California established a Health in All Policies Task Force in 2010, so we've had a bit of experience. And that task force has had a number of really great successes. We created an office, a tripartite office with education, health, and agriculture on farm to fork to really look at how do we get healthy fruits and vegetables to people where they're consuming food in schools and in workplaces and in communities. We've seen our transportation agency now include health and safety in their goals for their strategic plan. We've seen many agencies incorporate health goals and health criteria into their grant-making processes. And most importantly, 5 years later, we're continuing to see a lot of very fruitful and productive conversation among these different agencies looking at how does active transportation promote health and address climate change? How does violence prevention promote active transportation and promote healthier communities and allow kids to get better education? So these issues that we're dealing with, these social determinants of health, that really are what are driving health inequities in our country, require that we bring together multiple agencies because they're all complex. They have complex causes and complex solutions. And if health isn't at the table in shaping our community environments, our physical environment, our social environment, our economic environment, our services environment, we cannot create the conditions that are required to promote health and reduce health inequities. And that's really what the core concept is for health in all policies.
Thank you so much for your efforts, and thanks for educating other people.